So, chronic versus acute changes. So far, what we've looked at is the red line. That as we increase our intake, our pressure goes up, right? As our pressure goes up, that increases our output. That's why the y-axis says intake or output, right? Because they both go along that line. Now, what we know empirically from studying people and their urine, their how much they ins and outs, how much they take in, and what their blood pressure is like. We know that over time, changes in fluid and salt intake don't have a big impact on blood pressure. That's the blue line, okay? So if we have a patient who this is their normal intake, and they increase that by 6-fold, but they do it over weeks to months, we will see that their arterial pressure and their urine output, their arterial pressure is not going to change very much. Now, their urine output will, right? Otherwise, they would just be getting heavier and heavier, right? So, yeah, their urine output's going to increase, but their pressure isn't. So it means that there must be other systems that are playing a role in the long term, okay? And we're going to talk about some of those systems. But the other system, there are other systems that keep our blood pressure at a set point even as our intake changes dramatically, right? Not true in the short term. Listen, this curve affects all of us. If I gave you all 32 ounces of water to drink in 15 minutes, I could charge you to use the bathroom, right? Why? Because pressure diuresis is going to push that fluid out, right? But over the long term, if you start drinking a gallon of water every day, yes, you're going to pee more, but your pressure is not going to go up. Do you see the difference? So the acute versus chronic ins and outs. Okay, so let's talk a little bit about total peripheral resistance for a minute. Okay, so heart, caps, right? Heart, basics. Okay, roundabout here we have our arterioles, right? Now remember, we have lots and lots of arterioles all over the body. Okay, so when we talk about total peripheral resistance, we're talking about the total resistance across this section of the cardiovascular system, right? So between heart and back to the heart, all the arterioles and all their vasoconstrictions sum together to make total peripheral resistance. All right, now how does that matter? Blood pressure is cardiac output times total peripheral resistance. Now here's what I mean by that. The heart's pumping blood, right? If we push fluid into a system that has no pressure, right? There's no resistance to flow, but there's also no pressure in the pipe, okay? What TPR does is we take cardiac output and we push it into a system that does have resistance, right? So the blood is being pumped out, resistance is pushing back, so to speak, and in between we have blood pressure, right? That's what makes blood pressure. So if we stop pushing blood out, our blood pressure drops, right? If we take the resistance away, the blood pressure drops, okay? So we need both things. We need cardiac output, we need a functioning heart, but then we also need appropriate resistance. Something has to get in the way, otherwise we'll never develop pressure. Now, why does the pressure matter? Because remember, it's the pressure that the capillary beds use to drive blood flow where they need it, right? So the body is going to make this as stable as possible by changing this or this, okay? So one of the things we're building to is the factors that affect this equation right here. All of blood pressure management you can talk about in these simple terms. Cardiac output into total peripheral resistance. So for example, a patient with high blood pressure, we want to reduce their pressure. We have two ways to do it. We can make the heart pump less. That's kind of what a beta blocker does, right? Or we can reduce the resistance. That's what a calcium channel blocker does, right? Now, that's for the future, but just showing you the relevance, okay? All right, so that's total peripheral resistance. If we look at TPR over the long term, we see an interesting phenomenon, and that is that the body will affect cardiac output before it will affect TPR in long-term management. Okay, this is not a memorizable graph. Okay, each of these lines is a disease, all right? And each of those diseases causes either a big increase or a big decrease in total peripheral resistance, all right? So take that as fact for now, okay? So we have big differences. Now in this patient, or not this patient, but in patients with these diseases, their arterial pressure even is consistent across all these diseases, even though TPR is dramatically different between the different diseases. So what this is showing you is that the cardiac output is what the body will change. If TPR is altered by a disease, cardiac output will change to accommodate it.